Assalamualaikum and a very good day to all. We are from Universiti Teknikal Malaysia Melaka would like to present our project entitled DIIID COVID-19 Medical Trolley, or simply known as TroVid 2.0. As we know, currently the world is fighting with heavy pandemic spread. The COVID-19 pandemic in Malaysia is part of the ongoing worldwide pandemic of coronavirus disease 2019. The virus was confirmed to have reached Malaysia in late January 2020 when it was detected on travellers from China arriving in Johor via Singapore on 25th January 2020. And until 25th February 2021, the total cumulative COVID-19 confirmed cases in Malaysia is almost 300,000 with total 1,100 deaths. In Malaysia, there are certain hospitals that are dedicated to take care of the COVID-19 patients. For patients with low-risk symptoms, every state in Malaysia have their own quarantine and low-risk treatment center (PKRC). And from Kementerian Kesihatan Malaysia official website, there are 55 PKRC ready in Malaysia, such as MIPS in Serdang, Dewan Perbadanan in Labuan, and Kolej Kejururawatan in Melaka. When these hospitals and treatment centers receive a huge amount of COVID-19 patients, it is an alarming situation when there's risk of the hospital staff and frontliners infected with the same disease. Recently, in the newsfeed, 32 of the hospital staff in Melaka confirmed positive with COVID-19. This situation creates problems to the hospitals since the number of frontliners are insufficient to accommodate the growing numbers of COVID-19 patient quarantines at those hospitals and treatment centers. So, what we are trying to solve? The motivation of this project is initiated by the following problem statement. In this quarantine and low-risk treatment center (PKRC), the frontliner needs to distribute things such as food, medicines, and clothes to patients manually by using trolley. They need to be ready with full personal protective equipment (PPE) to avoid the high risk of infection with COVID-19. This product was designed to solve the second issue, which is to create minimum contact as possible between the frontliners and patients. Last but not least, we expect this product to reduce the frontliners' delivery of daily tasks which are currently tiring and exhausting. Therefore, we would like to introduce the IoT COVID-19 medical trolley, or known as TroVid 2.0, as a smart solution to overcome those previous mentioned problems with three specialties, which is automatic, easy to handle, and systematic. The objective of this project is firstly to design and develop the TroVid with an Internet of Things IoT applications. Secondly, the TroVid was designed to ease the frontliners such as workers, nurses and doctors to deliver necessary things to COVID-19 patients in PKRC. And finally, the objective of applying the TroVid is to avoid the physical contact between the frontliners and patients. This may help to reduce further the probability risk of COVID-19 infection among frontliners that may occur when handling the manually driven trolleys. So, what is the wow factor for this project? The first feature of the TroVid is capable to operate and run the TroVid by using a wireless switch as shown in this video. Secondly, the TroVid was designed with an embedded Internet Protocol camera that can be used to monitor any obstacles in front of the TroVid for the trolley to avoid or stop automatically when facing those obstacles. And the last wow factor feature of the TroVid is that we designed the trolley to act as human follower. User can set the color of their shirts into the system and the TroVid will keep following the user's track interactively. This function will really help the frontliners to deliver things to the patients in safe, COVID-19 risk-free and efficient pace. Here are the TroVid 2.0 demonstrations. The novelty of the TroVid has the following unique features. First, the product is equipped with an automatic visual guidance via an IP camera for the trolley to smartly moving around the allocated surrounding. The trolley also has a touchscreen controller via smartphone apps to automatically drive the trolley, as well as real-time video display depicted on an interactive screen. Moreover, to drive the trolley forward and backward, the wireless switch controller is used with an integrated power supply attachable to the automated trolley system. And finally, the trolley has a distance setup feature for automatic movement and navigations of the trolley in the PKRC. The TroVid has several potential advantages. It can save time for frontliners to distribute and bring things such as clothes, food and medicines when they are placed on the trolley eventually. The trolley also can be suitably used in many daily lives and feel as well as positively desirable in many applications. Moreover, the TroVid capable to avoid any obstacles ahead, safe to use and reduce risk of human injuries. The trolleys also follow human instruction accordingly and do not have limitation to move around in the rigid and specific path only. This TroVid 2.0 can contribute to the social impact, especially in medical sector, in which this machine can be potentially used and placed in hospital and also in quarantine and low-risk treatment center (PKRC). Tuan Yushahidah has used this TroVid 2.0 and this is her response.
Assalamualaikum warahmatullahi wabarakatuh. Saya Tuan Yushahidah Yunus merupakan seorang staf nurse yang bertugas di sebuah hospital swasta di Melaka. Semasa pandemik COVID-19 melanda dunia, saya secara sukarela telah bersetuju untuk menjadi sukarelawan yang bertugas di pusat kuarantin risiko rendah Melaka. Seperti yang semua sedia maklum, pandemik COVID-19 ini mudah tersebar melalui sentuhan dan udara. Jadi, setiap seorang yang bertugas merawat mana-mana pesakit COVID-19 ini merupakan insan yang berisiko tinggi untuk menghidap penyakit ini hasil jangkitan daripada para pesakit. Jadi, kami semua memakai PPE, menjaga jarak dan kerap mencuci tangan seperti mana yang disarankan oleh pihak UTeM. Antara satu benda menarik yang saya dapati di pusat kuarantin tersebut, sebuah troli yang dibangunkan oleh penyelidik UTeM yang mampu bergerak sendiri dengan kawalan pengawal jauh dan juga mengikut orang secara otomatik. Ini merupakan satu inovasi yang amat berguna di musim pandemik COVID-19 ini. Ia dapat meringankan tugas kami, para jurawat, kerana tidak perlu menolak atau menarik troli secara manual. Selain itu, inovasi yang dibangunkan oleh UTeM ini dapat mengurangkan sentuhan secara langsung antara jurawat dan juga pesakit. Dengan keupayaan yang ada pada troli diberi nama TroVid ini, ia mampu mengurangkan jangkitan penularan COVID-19. Pada pandangan pertama saya merasakan bahawa TroVid ini tidak berkeupayaan membantu meringankan kerja kami. Namun, setelah melihat ia berfungsi, ternyata jangkaan saya ini meleset apabila meskipun dikawal secara automatik, troli ini mampu membawa barangan pada kapasiti seperti troli biasa dan ianya memang dapat membantu meringankan kerja kami semua. Terima kasih UTeM.
The TroVid can be potentially commercialized to be applied at hospitals, store departments, shopping malls, cafe and restaurants, as well as can be widely used in the areas of food industries, factories and manufacturing field. Recently, this IoT COVID-19 medical trolley, TroVid, has a successful collaboration with Hospital Pengajar Universiti Malaysia, UTeM. We have been conducted a market survey on the project's applications in PKRC Melaka, and according to that survey, 94% of respondents agreed that the usage of the TroVid 2.0 can help the frontliner to minimize contact with COVID-19 patients. In addition, 98% of respondents supports that this type of machine is highly potential to be extended to all quarantine and low-risk treatment and also in hospitals. The next one shows the cost analysis of the TroVid 2.0. by considering assembly of the hardware and software of this product in its design and development, including the activities and costs incurred for research and development, promotions, market study, and etc. The TroVid 2.0 product is readily marketable at a reasonable price of 4,999 ringgit Malaysia. This project has been approved a copyright from the Perbadanan Harta Intelek Malaysia (MyIPO). And this project also have submitted for intellectual property IP. The project work also has been published in the International Journal of Electrical and Computer Engineering (IJECE) held in June 2019. In UTeM's Innovation Carnival, this project has been announced as a Gold Award winner and also achieved Gold Awards in Erica Innovation Expo 2021. Finally, here are line of the team members who contribute towards the reality of the TroVid 2.0. The project is led by technologist Dr. Norhashimah as the principal researcher, supported by his respective team members, consists of PM Dr. Rahim, Kamilah Jaffar, Nurul Kausar, Amalia Aida, Rohaina, Tan Kim Loong, and Muhammad Farik. That's all for IoT COVID-19 Medical Trolley TroVid 2.0. Thank you all.